I just didn't want to stop. I mean, I wanted to not be on them, but I didn't want to stop. It was just too hard.
Phase 2 is stop using. Our folks are coming in pretty hot. They're coming in with a lot of challenges, and so we don't expect perfection when people come into drug diversion court. We're getting them engaged in treatment. If they need medicated assisted treatment, we can get them engaged with that so they can help stabilize. We're going to get them a mental health evaluation so they can engage in mental health services if need be.
For many people, it is coming out of a lifestyle where their focus was finding the money to get the drugs, to avoid getting sick.
So drug court provides the medical assisted treatments to participants. So whether it's Suboxone, the methadone, or Vivitrol, but at least because what it did for me is it took off all of that stress and all of the worry. So it just took it all away. And then I could focus on doing what I needed to do for drug court.
Engage in the process and put your hours.
What I want you guys to think about is in addiction, when you were in active addiction, what were the things that you lost?
Treatment is the cornerstone of recovery. In treatment, participants attend groups and individual sessions.
How did you lose your freedom?
Because I'd go to jail.
Okay, so jail.
In this relapse prevention group at Therapeutic Health Services, participants really take a hard look at the losses in their lives.
Aaron, what about you? How many jobs?
Quit one.
Quit one.
And they make a plan for recovery.
You can't expect someone to get a job, let alone maintain their sobriety while being out on the street.
The majority of drug court participants are facing homelessness. We understand the importance of housing to recovery. So we contract with a number of housing agencies in the community. One of those agencies is the YATE program at the YMCA.
So it's a housing program specifically for young adults. We have 20 rooms.
It was like crucial to where I've come, how far I've come. The structure has like turned it around because, well, on the streets I didn't have anything. I didn't have any structure. I couldn't commit to anything. Now I've been religiously, on time to everything since I've been here. But then, then there's also other people that are my age. There's staff there all the time that I've made very good connections with and come to whenever they're working and be like, it's like, this is what's going on. If I have a problem, they're very willing to help.
Everyone here cares about the participants in the program. It's not just another program that, all right, go to your support meeting, go to this, go to that, and then we're gonna give you your certificate. Everybody here really cares.
I have a full-time job now, and I'm working, I'm making decent money, doing something I love. I'm a cook. I love making food for people. I'm very, very happy.